Joining us right now is epidemiologist, public health physician, and the head of communication, NCDC, Nigeria Center for Disease Control, Dr. Yaya Diso. He joins us from Abuja. Thank you for joining us on the program.
Really saying good evening. Thank you for having me.
Good evening. The World Health Organization declared the public health emergency over the global monkeypox outbreak. We understand that more than 18,000 cases of monkeypox have been reported from 78 countries, with more than 70% of cases reported from the European region, 25% region of the Americas. What would you say has led to this widespread of the disease in these areas?
Well, the origin of this is still being investigated, but what we know that is the driver of this current spread is a sexual behavior among a particular group of sexual orientation. So, and then it's spreading so fast in countries in Europe and including America. And so what is clear is the sexual behavior among MSM, that is men are sleeping with men. But that is not the case in the cases we are reporting here in Africa and in Nigeria especially.
Yeah, because my next question was really, is that also why we're seeing more cases in Nigeria, seeing as this is a disease that is endemic, but it appears that it has surpassed what we used to record years past?
Well, in Nigeria, since the re-emergence in 2017, we've been reporting sporadic cases. And this could be because we're fighting our surveillance system to be able to detect these cases and report them real time. But the recent outbreak, global outbreak, has also, created enough awareness and everybody is worried. And I think that is good for us to be able to detect these cases more. And you can see that before, we have very few cases, states reporting this in the country. But now, this year alone, we have had close to 26 states that have reported cases. And this will also be linked to improved surveillance system due to COVID-19 outbreak response and the channels that we are using for COVID-19, community informants that have been trained, and everybody is sensitive when they see anything that is unusual, they are more likely to report. But there is still a lot we need to do. And then genomic sequencing for us to test the variants is also ongoing. The one key thing we have found out in our clients, there has been no change in transmissibility, and then even the variant has not changed, still the West African cloud. Then with regards to whether it's transmitting between when you look at the sexual orientation, we don't have data to support whether it's men to men, but here is this normal transmission between close contact. That is what you have established so far.
Do you think there is enough awareness to forestall fatalities, awareness as to how monkeypox spreads, as to the symptoms?
Awareness is increasing. I cannot say awareness is enough because we recently conducted a perception survey among the population, especially in endemic states. We still see that a lot of people say, okay, yes, they are aware, but when it comes to cause of monkeypox and then some basic information about mode of transmission, so we still see some gap in knowledge. And then, but the more states that we engage, that is, especially states that were not reporting before, that are now reporting some few cases, we need more awareness to be done there. And then again, we have also trained our health promotion officers across the states to also support this community-based surveillance and then to make sure that there is synergy in reporting of these cases from the community.
How does monkeypox differ from other diseases like COVID-19?
Well, for both of them are viral illnesses, but when it comes to mode of transmission, monkeypox is close contact with somebody who is infected with the disease and who is manifesting the symptoms. But for COVID-19, and when I say close contact, is that it's skin-to-skin contact. But for COVID-19, is by droplets. Transmission is by droplet. It's just close contact when you are close to the person within or less than 1 meter, and the droplet can fall directly on you. So you are more likely to pick it in that situation. But with regards to manifestation, They both have general symptoms like fever, headache, and so on. But what is characteristic for monkeypox is the rash illness. I mean, the rash that appears from the face and that progresses to other parts of the body. But both of them have fever and then some other things. But for this other, COVID-19 has cough, mainly because it's a respiratory illness. But there are some strains or variants that do not manifest with cough. But monkeypox is not respiratory illness, it's more or less a skin lesion. But it's also transmitted through skin-to-skin contact and other anything that can bring you close contact, like maybe mouth to mouth, and then again, if there is abrasion scratch on the skin and you go in contact with the body fluid of infected person or animal, then you are likely to get the virus.
Do we have access to monkeypox vaccines in Nigeria?
Well, because it's a global outbreak, it's a conversation that the WHO is driving now to see the minimal, available vaccine, how this can be, make sure that countries that are affected, especially the vulnerable population, will access it. But there is a conversation that's ongoing. Right now in Nigeria, we don't have monkeypox vaccine. But I know that we will get there once the right conversation is concluded on this.
We hope that that is soon. But let's talk about COVID. In the past few weeks, countries have reported gradual rise in infections. Also, I believe in your latest epidemiological updates, that of the NCDC, there's an increase in the positive test positivity ratio. Why is this? And I mean, is there like a new wave of infections, and what strain is circulating?
Well, I'm not surprised if you're having a new wave of infection, because globally cases are rising and Nigeria is part of the globe, and movement in and out of Nigeria. So that's first thing. Then the second is seasonal infection. This period of the year is rainy season, where you usually have increase in the number of cases of respiratory tract infection. And COVID-19 is a respiratory illness, so it could also be a factor that is also driving this. More importantly, because we have abandoned our compliance with the non-pharmaceutical intervention, just because the federal government has relaxed protocols at the point of entry, they review the protocols with regards to travel protocols and so on. So because of vaccination. And then so that could also fuel the spread we're seeing. More importantly is the issue of vaccination. We still have low vaccination coverage, even though it's increasing gradually, but the Nigerians still need to take more of this vaccine, as in more people, eligible population need to take this vaccine, so that we can have break in transmission at the community level through herd immunity that we are developing. So the host of factors like a combination of these accounts for. Then the number of people that are doing tests because of symptoms people are having that are now pushing them. Maybe they treat malaria is not going, they now feel will be able to go to hospital. And then with index of suspicion that is also increased among healthcare workers. So these tests they are demanding for these tests, and then those of them that are positive are being detected. So that will be what we are having right now. And if you look at in the previous years, we always have a peak around this time that coincides with the rainy season. So those could be indicators that we will be entering another wave of COVID-19 in country.
I want to quickly get your thoughts. WHO confirmed 2 more cases of the Marburg virus in Ghana 2 weeks after the country reported its first outbreak, a highly infectious Ebola-like disease. Should we be concerned?